Okay, guys, listen, we're going to go through the immunologic emergencies. Basically, we're going to talk about allergic reactions, and some other stuff in this actual section of the course. I am not going to lecture on everything here. I'm just going to kind of break this down to points. I want to make sure that you guys are still going through and making sure that you guys are looking at this PowerPoint, just so that you guys don't miss anything for National Registry. So when we're talking about the actual anatomy and physiology of our immune system, it helps protect our body from foreign substances and organisms, right? So when you guys are exposed to something, your body goes on alert, and it initiates a cascading effect of different things in your body, which we're going to go into here in a sec, on the response that the body gives in order to try to defeat whatever foreign substance or organism that you were introduced to. So when we're talking about the actual pathophysium allergic reaction, there's basically two different types. We have like a localized allergic reaction, which can be detrimental to us, or it doesn't necessarily have to be. And then we have a systemic allergic reaction, also known as possible anaphylaxis. Okay. But basically, when we're talking about an allergic reaction, the definition of it is an exaggerated immune response to any substance. Guys, you guys can develop an allergy to anything at any time in your life, okay? You don't necessarily have to be born with it. Usually it's either foods or some kind of medication. We are seeing that there is at some point, certain types of allergic reactions are actually being found to be hereditary in nature. There's been some interesting studies out there on that, but you guys might be eating strawberries one day, and next thing you know, the next time you eat them, you could be allergic to them. It's just how the body actually sees the substance, if it is a friend or a foe. Okay, this is caused by the body's immune system, and we're going to talk about that a little bit, not too much at the basic level, but we are going to talk a little bit about it. Basically, our immune system releases chemicals to combat stimulus. The chemicals that are released are also known as histamine and leukotrienes. Okay, and we're going to talk about both of those. And again, this could be very mild, it could be local, it could be extremely severe and systemic in nature. Okay, so let's go through this as easily and smoothly as we can. When we're talking about anaphylaxis, it is a extreme life-threatening allergic reaction. It involves multiple organ systems, and it can rapidly kill you. It is the body's response to some kind of antigen that the body has already developed antibodies for. We're going to talk about that here in a minute, on the actual process of what happens when you guys do get exposed to something. So in this slide here, you guys can see that we are using the example of a bee, some kind of outside influence that's going to give us some kind of antigen with which we're going to develop antibodies for. Okay, so there's something called immunoglobulin E, or what we abbreviate as capital I, lowercase g, capital E in our system. That's called immunoglobulin E. When you guys are introduced to some kind of outside toxin, that antigen, right, usually hits the red blood cells. And when it hits that red blood cells, it gets circulated throughout the body. Well, the body will actually create a protein structure known as an antibody, so that when this antigen is reintroduced to the body will be able to recognize it, and the antibodies start to attack the antigens. So, however, it could take a little bit for the body to actually realize this. So we get stung by a bee, and those toxins get thrown into our blood system. It's carried through our blood system through our red blood cells, and those toxins attach to something called mast cells. Mast cells are also called feeding cells. And what they do is the antigen gets attached to the actual mast cell itself, and the mast cell swells because it's being attacked by this antigen, and it pops. And when it pops, it releases histamine. Well, we have this whole kind of histamine response, right, throughout our body, and it could be so overwhelming that it can kill us. Okay, and when we're talking about anaphylaxis, It affects all three of the big three. It affects your respiratory, it affects your cardiac, it affects your neuro. All right. Respiratory, because of the massive amounts of swelling that can cause in your upper and lower airways. Okay. With wheezing and stridor, and basically pretty much in the back of your posterior oropharynx, it can go all the way down to your larynx as well. Okay. With the cardiac, it can raise our heart rate. Okay, if we're raising our heart rate and we keep our heart rate elevated, we're getting a decrease in cardiac output because we're not allowing the actual heart to fill with the amount of blood that it's supposed to be filling with before it squeezes. In turn, that will lead to a low blood pressure. And again, remember that we're talking about a shock here, right? So the difference between a compensated and a decompensated shock in any of our patients is a change in blood pressure. As soon as we start seeing those numbers start to drop on our patient's blood pressure, they are starting to decompensate. We are behind the 8 ball. We need to start getting aggressive with our treatment. So some common signs and symptoms that you guys at the basic level are going to see. These are basically the only signs and symptoms that I'm going to be kind of holding you guys to. I am going to talk about a few more during this lecture, but we're going to try to keep this as basic as possible. Okay. The big one is urticaria, also known as hives. You guys can see the hives on this picture. Those actual little kind of welts that you guys see are known as wheals. They can actually appear to be a little bit more darker purple, but they will be raised off the skin. It can have a itching or burning feeling for our patients, and yes, it is very important that we do not have them try to itch those as best as possible. Okay, but you guys can see the blotchiness of the skin in this, and those are your classic signs and symptoms of hives. Let me tell you another thing about hives is really, if something's going on top of the skin, it's also going on underneath the skin as well. So keep that in mind, that some hives are more important to us than others. Like, this is on the patient's lower back. Okay, yeah, they are a true sign of allergic reaction. This can be a life threat, but compared to a lower back, and if I had these on like somebody's neck, I'd be a lot more concerned about the patient with somebody which had urticaria on their neck than I would be on the lower back. Again, I'm not trying to make one sign and symptom of anaphylaxis sexier than the other, or make one patient more critical than the other. If we have urticaria, we have urticaria. Okay, we are having allergic reaction more than likely. I just think that by looking at somebody and seeing where that actual urticaria is, just remember that if it's happening on top of the skin, it's actually happening underneath as well. I would hope that from what you guys already have learned in this class, that this picture will scare the shit out of you. This is some more signs of anaphylaxis. This is known as angioedema. This is localized swelling, so angioedema is more of a localized reaction. However, angioedema is mostly found in airways. Usually in the posterior oropharynx. It could involve the tongue, it could involve the pharynx, it could involve the larynx as well. So yes, it is a localized allergic reaction, but it's a pretty important localized allergic reaction because it is dealing with the patient's airway. Most of the types of the actual angioedema, again, this is something that can be caused from food. It can be caused from drugs, specifically some of our very common high blood pressure medication that are out there, known as ACE inhibitors. Their medication is also known as like lisinopril, or anything that ends in pril. PRIL is an ACE inhibitor. They can cause this. We can have people on this stuff for years, and all of a sudden they take it one morning and boom, it causes angioedema. All right. Well, let's talk about this picture for a sec, though. Okay. Yeah, she's not looking at you. Okay. So that's of a concern, right? She's not tracking your guys' approach. However, I'm going to say her skin color looks pretty good. Okay, so she's getting perfusion. She's getting good, adequate gas exchange, right? She might look a little bit moist, maybe, but she's not like sweaty. So this was definitely the tongue coming outward and not backwards, right? But that is definitely some concern. You guys can see this with anaphylaxis, but just so you guys know that angioedema can happen by itself without having the systemic urticaria and everything going on with the anaphylaxis. And then wheezing, right? Wheezing, everything's kind of becoming inflamed in the respiratory tract. We can hear those wheezings due to the actual constriction of the bronchi, or the swelling or the irritation of the bronchi is kind of starting to close shut. Common allergens out there is food, without a doubt. Food, really, it can take up to about 30 minutes to actually appear. And that's just because we actually have to get that to process into our stomach and kind of break it down for those antibodies that we have already created to actually recognize the food that we ate. However, it can happen instantly also with some people. Specifically people that are allergic to peanuts. And I feel bad for people that are allergic to peanuts. I want you to go to the store next time that if you guys are bored or whatnot. I want you guys to go to the store and I want you to look at the list of ingredients on the back of your food. Okay? At the food that you guys like to eat. All right? And I want you guys to imagine that you guys have an allergy to peanuts. Okay? I guarantee about 90% of the food that you guys eat, if you had an allergy to peanuts, you would no longer be able to eat, because peanut oil is found in a lot of things, guys. Okay? So check it out. Have a game of it next time you guys go to the food store. It's you'll feel sorry for those people that actually have allergies to peanuts, because everything has some kind of peanut in it. It's unreal. Medications. A lot of people are allergic to antibiotics. Okay, specifically penicillin. They do say that is because of the use of penicillin way back in our parents' lifetimes or our parents' lifetimes, right? That they used penicillin so much that people actually became allergic to it, unfortunately. And there's even more. The erythromycins are huge for people that might be allergic to. And then NSAIDs, those are your aspirins, your ibuprofen, stuff like that. The non-steroidal anti-inflammatory drugs are very common allergies as well. Medications, again, we're going to continue on this. They are very popular for allergens. You know, obviously you won't know if you're actually allergic to something until you swallow it, right? Or unfortunately have to inject it. Depending on how you guys actually take that medication also can lead to the severity of the symptoms, okay? If we are injecting it, that reaction can be immediate and it can be very severe. Where your oral medications, remember your oral medications take anywhere between 30 to 60 minutes to actually work, depending on the actual patient themselves and how good their actual liver functions are, right? But they could be less severe, or, right, they can steadily grow, okay? It's almost, and again, I'm not trying to categorize allergic reactions for you guys, but somebody that actually has an injectable, some kind of medication that's an injectable, and they take it, boom, it happens quick. It's severe. It's straight to the point, right? It's something that we're going to notice right away and be able to be really aggressive on our treatment. However, when somebody actually takes that medication in a pill form and they have to swallow it, again, that might take 30 or 60 minutes to kick in. So all of a sudden, like 15 minutes after they actually took this and the actual medication starts breaking down, they might develop this kind of just real small hints of shortness of breath every now and then, or all of a sudden develop this kind of like dry, hacky, persistent cough. And then all of a sudden, as we're starting to move further and further down the timeline, these symptoms become more and more and more and more severe. So hopefully this lecture will help you guys kind of recognize these signs and symptoms in order for you guys to be able to kind of put that on the back burner for you guys, and see to make sure that you guys are reassessing your patients after every intervention, and kind of finding out what your patient needs from there. Plants are also pretty popular among our allergic folks. I think all of us have small allergies to plants. If you guys suffer from allergies every spring or fall, you guys are having a little localized reaction to these. Might not be an allergic reaction, might just be a sinus infection or some kind of sinusitis, but either way, it's an irritant for you guys, right? Dust, pollens, pet dander, right? The big ones, ragweed. We don't have too much ragweed out here, but in the Midwest, it's big time, man, and it'll make your eyes itch like a son of a bitch, that's for sure. Maple and oak, some chemicals, maybe, ladies or guys, maybe you guys are allergic to your makeup, who knows nowadays. Soaps, hair dyes, right? Latex usually is still a pretty big allergen out there, and that's really, I don't know any, maybe besides like sterile gloves used for deep suctioning on an ambulance. I don't know any ambulance that actually carries true latex gloves anymore. All of us really have the nitrile gloves that we use as an alternative. But I'm pretty sure that our sterile gloves are still latex, and that's something that you guys will learn when you guys get into your services, specifically for deep suctioning down an LMA, or possibly even a King if you had to, but that's service dependent. You guys will learn that in your services. Last but not least, insect bites and stings. Okay, usually when the insect bites, it injects some sort of venom. It's an irritant. Some are more deadly than others, obviously. But usually this reaction is a localized reaction, so we're going to get some swelling and itchiness to that area. If it does become systemic, it's going to involve the whole body, and that's where we're going to start moving into our anaphylactic shock.